Sorry, it automatically did that.
That's all right.
That works. Have you let the people in?
Mm-hmm.
Okay. Hey, folks, everybody that's already signed on, thank you for being here. I'm sure there was some confusion, but everybody's super busy and there's been lots of different things going on. We are going to wait a couple of more minutes because we're waiting for Senator Hicks Hudson and her office to get on the call, and then we'll go from there. I promise we're not going to be long, but we are just going to make sure that we hit a few points and then we'll go, like I said, we'll go from there.
And thank you, Senator. And just so everyone in the audience knows, we do record our meetings so that we can then have the archive of them and upload those to the Senate Democrat YouTube webpage so folks can go back and revisit our previous meetings. Those are all uploaded, and this one will be as well to our YouTube page, the Ohio Senate Democrats.
Just to fill a smidgen of the gap, I hope everybody's summer was good and they've got their heads screwed on tight because it looks like we're going to have a heck of a whirlwind when we get back in session in Columbus starting shortly. That, and then of course we've got everything that's coming up for next year, not just primaries and the election. We also have America 250. So we've got lots of things going on. So I don't know, Deja, it's 12:08 now, according to what I have. What do you have?
Yeah, 12:08. I think we're still waiting for them to join. I don't know if we want to just give it another minute. I mean, if not, whatever you want to do, Senator.
Let's do this. Let's say at 12:10 we start because we're on other people's time too. And I appreciate folks taking the time to be here so that we can continue to remain relevant with a very critical topic that's not going to go away anytime too soon. Hopefully it won't be as much hard work as we continue to do some of the things that have been done with the children and youth, et cetera. And as we go over the budget today, we'll be able to take a look at what has been done. And then, of course, I'm here to ask the question of you folks or anybody that's on the line that wants to tell me what you think we need to be doing that wasn't in the budget. Some things that may not be obvious to the rest of us. As lawmakers, we need to hear where we are and how much further we need to go to make this right.
Well, and Senator, I will say, I don't know if folks in the audience had seen, I believe from what I've seen on the news recently today that at the federal level, they're coming back, the Democrats are coming back with a bill to potentially block or revert some of the federal provisions that were included in their budget that passed back in July. So that's something to consider. If I read that correctly in the news today, you know, the slideshow we're presenting on is in response to the current standing federal budget provisions that were passed. But even considering that, as you know, they go through the work of maybe coming back to revise some of the provisions that the federal government did, you know, can even change maybe some of those outcomes. So I guess we'll just have to follow that as well to see updates on if that bill does come forward or, you know, what they're doing in DC.
Yeah, definitely. And even if the bill gets heard, here that's part of the difficulty as to where we are right now and what's happening across our country is that there's this divisiveness as to who brings the bill, whether it's Democrat or it's Republican. The reality is that it's about the people and it should be neither. Party affiliation should not make a difference in hearing whether or not um, SNAP is necessary and going to be changed, or to the point where all the things that make it seem as if we're going to get rid of people who are preying on our economy. And the reality is we just have people who unfortunately are in situations in which they need assistance in many, many ways. And so we'll go from there. So since it's 12:11, I suggest why don't you, Deja, go on and start, or if Amber's on, then you guys can go back and forth with where we are as to going through the slides, and then we'll go from there.
Sure. Well, thank you so much to everyone who was able to join us today. Today, we're going to be focusing on just covering some highlights from both the state operating budget that was passed earlier back in July, as well as some of the highlights from the federal budget that was passed. We were just trying to give an opportunity to hear back from the folks who are on the ground and will probably feel these impacts and these changes more directly as they're, you all are doing your work. So we're going to go ahead and talk about that. So this is our agenda today, and we'll have time at the end of the meeting, per usual, to open it up to the attendees to submit any questions, comments, or things that they would just like the senator to maybe elaborate on further, or even we can, follow up after the meeting with other questions or comments. Senator Ingram and Senator Hicks Hudson, the co-chairs of the Black Maternal Health Caucus. And before we get into, the budget highlights, most of everyone attending today is pretty aware of the state of Ohio and, the way that we are handling infant and maternal health and where we're at with that. So this is just a brief overview to remind us that, Ohio is not at the top when it comes to these provisions, although a lot of people are doing good and hard work on the ground to help reduce, some of these statistics that we're seeing, and more so the reality that people are facing when they are planning to give birth or have children here in the state of Ohio. So I won't go through all that because most of us are familiar, but you can take a second to look at that. So we can just go ahead and get right into Ohio's operating budget overview. And again, these are provisions kind of specifically focused on infant that would have direct impact on infant and maternal health here in the state. So we'll first talk about, the budget, House Bill 96. It was passed back in July. There were some wins, some positive things that we can highlight because these things do go directly to the people on the ground who are doing this good work. So a few things to mention is the $36 million allocated to continue supporting infant vitality efforts. And to note within that, there was $5 million allocated to community-driven programs, specifically with Cradle Cincinnati, who've done a really phenomenal job at reducing infant and maternal mortality rates down in Hamilton County. And they recently were allocated funds through Controlling Board on Monday to expand their framework of care to other counties throughout the state because of how well their approach to reducing these outcomes have been for Hamilton County. So another one was a big topic during the budget, Help Me Grow, which is like home visiting to moms and new moms and babies. And that was $21.5 million increase from the last budget to the budget that was passed this year. And then there was $200 million in federal funds that came through for child care choice vouchers. And then continuing on to some more highlights, there was $10 million allocated for the child care credit pilot. So it's a pilot program. So obviously, it's to see how well this will work, and hopefully we'll see that continued moving forward. This was presented as a standalone bill. I don't know if this is exactly the same language from the standalone bill that was presented, but it kind of splits the cost of childcare between employers and employees in the state. There were changes to publicly funded childcare. It moved from, or it became an attendance-based payment structure to an enrollment-based, and this benefits providers. And then $1 million over the next biennium for stable housing for pregnant mothers. And then the last two provisions were something that I know Senator Ingram, as well as others, really advocated for, because these were things that popped up in the budget before it was passed to remove them. So there was a language in the budget that had removed coverage for 0 to 3-year-olds for Medicaid enrollment. Luckily, this was vetoed during the governor's list of vetoes he administered. And then the other provision that we worked hard to advocate to restore was dual access to Medicaid. They had originally in the budget, before it was passed, proposed to cut it down or limit the access of which counties can receive this kind of payment through Medicaid with doulas. And they had also originally capped the money amount at, I think it was $500,000. So, obviously the concern of the senators was, when this bill was passed, Senator Hicks Hudson, I know, worked really hard, as well as others that she worked with, this is a bipartisan bill to pass, to get that doula support to mothers, because it's been proven to reduce infant and maternal mortality, and just have better postpartum health outcomes and things of that nature. So it's a really good win to be able to restore that to all 88 counties, just like the bill originally intended, to have access for everybody to be able to take advantage of that. So those are just some of the highlights from the bill. Again, very high level, and I'm sure we could all get into details about each of these provisions. But then I do want to point out that there are still a lot of gaps that remain. And Senator, I don't know if you want to speak to some of these gaps and maybe how they are have negative impacts on the work that we're trying to do, or I can cover them, but if you'd like to.
Well, you can just go through them, and then, of course, if anybody has any questions, because I know that there may be some, for instance, the attendance base versus enrollment base. That was, most people may not realize, and of course, that leads us to that whole daycare piece that does impact mothers, especially if, say, you're expecting and you have 2 of your kids. That makes a huge difference as to whether or not they're covered. And so your anxiety and your stress level, which of course a lot of what's wrong here is based on some of that stress. But you can go on and go through them for, the lead-based poison. And then if we have any additional questions, or if I have any additional comments regarding them, then I'll do that at that time.
Okay. So then again, here we get into some gaps that were very important to highlight, where we feel the budget did not, champion the improvements to continue the improvements in maternal and infant health. The big one that we definitely advocated to include was funding for lead poisoning, but we've seen a significant cut of $16.5 million in lead poisoning prevention programs, which I'm sure many people know that a lot of the homes in our state are very old and contain lead, and exposure as a child to those can have negative health outcomes, like in the development, and it's just toxic. And we've done a lot of lead poisoning treatment and prevention in the past, so to see this much money be cut from that obviously was not good. No refundable child tax credit for working families, which again, something we really advocated for, but we did not see in this budget. Another big issue that a lot of our advocates had came and spoken about, and looking at our neighboring states, I mean, a lot of states throughout the country have increased their eligibility for publicly funded childcare. We we kept it capped at 145% of the federal poverty level. I know there was different levels that folks were advocating for, even attempting to find a common ground to at least raise that number slightly, but we failed to do that in the budget. And then there was $26 million slash from the Family Connects home visiting model. And this is just another model that was working to help reduce postpartum complications and emergency visits after birth. And then the big one that we're all paying attention to is that Medicaid expansion population trigger language, which is the group 8, the working population. And that's something we're obviously still paying attention at the federal level. And, this is if the federal says that they're going to even $1 decrease their share of Medicaid payments that they do for the expansion populations, basically what the state has in the language as it is that we would just stop completely then. We didn't find we weren't able to find a middle ground when we passed the budget that at least could wean it off or some type of safety net there if that were to happen. And then a notable one is regarding the sweetened drinks with, if you have SNAP, kind of this, let me read it here. So it was vetoed by the governor that had the restriction on what you could spend your SNAP dollars on, specifically with sugar sweetened drinks. That got vetoed, but the governor mentioned that he does expect maybe in that next round of us coming back to potentially override some of the vetoes, that this might be one of those that may be overridden and reinstated. So these are just a few of the concerning things that we find in our budget that we feel does not align with the mission to, make Ohio a place to raise a family and have good health care. And yeah, Senator, if anyone wants to, and you can always put your questions or comments into the Q&A tab that's going to be at the top of your screen on a laptop or at the bottom of your screen if you're on a phone, I believe. So it looks like we do have someone in the Q&A. It's Charlita Tavares. Thanks for joining us. I can read her message out, Senator, if you would like to respond. I can read it for the group.
She can ask it. Can she get in to ask the question herself?
Well, with the way that the seminar is set up, it doesn't allow.
Oh, okay. Can't get anybody in. All right. So yes, then do read the question again.
Okay, so Shirley Tavares says, Senator, I appreciate you and Senator Hicks Hudson for your ongoing leadership and commitment to addressing infant and maternal mortality. Great work. She wants to ask how we as advocates and policy experts can help with messaging and media campaigns to share this information. Are there slides or Facebook, Instagram, other messages you can share that so we can spread them through our social media and letters to the editor? So I think maybe getting at just spreading the awareness of the Black Maternal Health Caucus period and making sure it's being reached to those, because it is always open to our constituents, anyone who wants to join on and listen in.
Let me say that part of what I'd hope that everybody would be doing is making sure that they are spreading their word, and of course, making sure that when they look at us as policymakers and we're here in this budget, that they're being heard on an ongoing basis. For instance, with the whole lead poisoning, who is that impacting that there won't be those dollars there? What difference will that make in babies and mothers who have to live in those homes, unfortunately, that were not abated properly, that they're still in the urban core, some of them, and even some of those older homes in our rural areas that still have lead paint, and it's impacting those children. And of course, those are things that we need to be saying out loud. So spreading that message is something that says, this is still important. It doesn't go away because we have a pilot project, because Queens Village is going to be spread from, they spent some dollars. So what? What does that mean? And what are we trying to get to? And so my expectation of Senator Tavares is that I would hear from you when you go, wait a minute, that doesn't make any sense. Why are you guys doing this? Why are you doing that? Or maybe you should be doing this. We're not the experts. I don't care what anybody says. You guys are the experts. And I need to hear from you what I need to be doing with daycare and what difference SNAP makes. What difference does sugary drinks and SNAP make? Well, maybe they shouldn't be buying sugary drinks, except that what does that mean? I don't know.
Well, and I will say, Senator, too, I think you're right. Obviously, it's always good to have people come to us and be able so that we can know what's going on the ground, since, like you said, you're here, but we're not, at the clinic or in the community working directly with in the healthcare space. So I think also maybe to Senator Tavares's question, maybe in terms of like if you're talking about spreading the information of the actual Black Maternal Health Caucus in our meetings, we were on like a summer recess because the legislature was on a recess as well. However, we do have monthly meetings beside this past, the summer break. And you're always more than welcome when we send out our meeting notice. This is our first one back after the summer break, but whenever we send out that meeting notice, the initial one, you're always more than welcome to take that information and share it with your own network and encourage other people that maybe not heard of the caucus before. They're always more than welcome to join on, post it on your own Facebook, spread the information that way too. There's no issue with sharing the Zoom link to others to be able to join on. So I will keep going because we do have some other slides here. So I wanted to briefly highlight some of the federal budget. Again, this is just very, very high level, and we more so focus on some concerning aspects that we've seen coming out of the budget. So kind of it aligns with obviously what's happening at the state, but these are just a few issues that we're definitely paying close attention to, Senator. As the federal budget had been enacted, I know a big one is the attacks on like places like Planned Parenthood and the threat of those facilities not receiving Medicaid payments for the work that they're doing. Specifically, the fact that they're providing abortion services, but it's so important to note that these facilities offer much more services even beyond just abortion care. A lot of times these are maybe even the only facility that's close enough or maybe available to the people who are, utilizing their care. So to reduce any form of access to health care, is not a helpful move. So, we've seen that a lot of Planned Parenthoods have shut down or shuttered under these kinds of threats. And then an additional provision, there was changes to Medicaid and the CHIP eligibility rules. Again, it's more of like this unknown of how this is going to play out as it makes its way to implementation. And then lining with what the state's doing, it's this last bullet point goes right into the same thing that we mentioned earlier with the trigger language. That's that 700,000 Ohioans that we're referencing in the Group 8 population. Just those threats that if they do cut Medicaid funding to Group 8 or make changes like the work requirements and things of that nature, what could that look like here at the state level, and how does the state, provide a state safety net, or if they're not going to, what does that mean for that 700,000 Ohioans? So, essentially we're bringing everyone here today to hear from the folks on the ground, the work that you all are doing and how these things are directly impacting you, or if you're seeing that direct impact or how you're planning to navigate that. We have a few like guiding kind of questions here to help facilitate the conversation and to get people able to think about what is that looking like for them on the ground. So we do have another question here. Oh, it's just from the Senator Tavares saying to make sure to follow up with any material. So we will send out the PowerPoint to everybody and it's recorded, so you can have all of these slides. We'll share that with everyone. So these are just a few of the questions, Senator, that I think that we think are important to gauge with those in attendance and even those who aren't attending to think about how you, as here at the Senate, can maybe help.
And I want to ask a question too of the people that are and I hate that we can't interact, but I want to ask a question of folks and maybe they can just simply let us know at some point. Who else do you need to hear from that you have not heard from? My question becomes, especially with the creation of the Children and Youth Division and a lot of what took place through Jobs and Family Services concerning our young people preschool, daycare, things of that nature have all been transitioned to children and youth. Have you heard from children and youth the way you should, especially with those mothers, those expected mothers, and that overlapping that is so very important? Do you hear from who you need to hear from as far as changes or anything else? And I know that's just a question I threw out there, but hopefully somebody will call the office and go, you won't believe we've been here and children and youth has existed for a year now, and we still don't know who handles what. And so that's a biggie for me. I also am concerned with birthing centers and the fight we've got. I shouldn't call it a fight. The disagreement, I think, that we have on birthing centers and how they should function and whether or not they should only be located at hospitals or those agreements be ironclad agreements, if indeed there are certified birthing centers, midwives, doulas, people like that that need to be in the mix of childbirth and child care.
Right, and I know Senator, we have, it's Senate Bill 140 is your legislation to address the freestanding birth centers, because we've seen a lot of them close or not be able to fully open and operate because of the transfer agreements that they're required, at least the way it's currently written in the revised code, the way in which they have to facilitate that. A lot of the major hospitals have been maybe, there's been a little disconnect there in approving those. So it's making it harder for those facilities to open and fully operate and take patients in. That could be just another way to help, alleviate the burden or make people have more access to care. And I think Director Dawson of the Commission on Minority Health Senators, she made a really good point, I remember a few months ago. And she said that, until we perfect or maybe completely reduce these outcomes and everyone's healthy and doing well, the reality is we need all of these different kinds of services and people working in their different models, because it's all boots on the ground if it's at this point. And until we get to that point where maybe it's completely solved, we're going to need everybody involved and everyone at the table working together to reduce these outcomes and make it better for our children and our mothers. But I just want to remind everyone again too that if you have a comment you would like to share, you can put it in the Q&A. You're always more than welcome to follow up with our offices as well if there's additional questions or comments, after the meeting. But we definitely encourage you to submit it to the Q&A. Sorry, we can't have a direct conversation just with the style of the webinar, but
We'll have to work on that one because that's one that I want to make sure that it's as open as possible. And of course, if you got to put things in the Q&A, it depends on. I know for a fact that there are folks who are doing other things while they're listening to this conversation who may not be able to get into the chat and put their question in, but they do have a question.
right.
I will say this, and you may want to add to Deja that in the future, in the near future, we are going to hear from children and youth, aside from the program with their agreement with the Children's Hospital in Cincinnati and Cradle Cincinnati and Queens Village. We're going to hear from children and youth across the state what they're looking at and their intentions are, especially since much of that is in their under their purview as far as mothers, maternal health, and that's maternal health for everybody. Despite the fact that this is Black maternal health, we're talking about maternal health for all of our mothers.
Right.
And whether or not they need some maternal health, as I indicated before, is negative due to lots of stress. So there are things too that we need to be addressing that don't get addressed when we nix out doulas and midwives and forcing people to do it my way or not at all.
Right. 100%.
So we will be hearing from them. As a matter of fact, that's something else I'll ask you. Is there somebody else, and I said that before a little, but is there somebody else you need to hear from, or you think we need to hear from that you don't have, that you don't think has been able to get their voice out there?
Right. Yeah, we're always welcome, like those sort of suggestions of, whether bringing, because the point to bring everyone together is to like have this space to talk about these things, and whether it's folks would love to hear from, yeah, like it's maybe bringing the Department of Children and Youth, or, the Commission on different agencies we can bring in, Department of Health, we can always, have them come in and present, or like Senator Ingram had mentioned, if there's people in your community maybe that we're not entirely familiar, or you feel the senators or elected officials who are listening to the call maybe need to hear about as well, to hear about the work that you all are doing, is definitely important. And we're open to taking those suggestions, of course, of who to have on the call.
Deja, I can't see because I'm on my phone. Is Senator Hicks Hudson and her office on the call?
I do not see them on the call, but we can definitely follow up with them afterwards.
Okay, I know she had another videoing that she had to do today, so maybe that's it, that they've gotten held up a little.
Well,
We originally presentation today besides us, but things happen, and so therefore, if there's anything else, Deja, it's on you.
Well, I was just gonna ask if it's good, maybe we could do a little, just drop in the chat to say about the second annual Black Maternal Health Summit. We could put a little reminder out there to everyone. We were grateful for the turnout, and yeah, I feel like the outcome of the first annual Black Maternal Health Summit we had earlier in April this year, and everyone that was able to be there with us in person, all of our panelists, the participants. So I feel like now maybe it's a good opportunity. We'll formally follow up in the near future, but for the people on the call, to let you know that the second annual um, Black Maternal Health Summit is in the works and will be held in April again. This time it will be held in the atrium of the State House. So definitely keep your eye out for more information as we continue the planning of that. And we're definitely excited to hopefully bring even more people down here to the State House, to be able to come together and be in person with one another to talk about this important issue. That's really all I had, Senator. I figure I would just put that out there so people are starting to think about that. I know April's a little far out from now, but a lot of planning to do around that time. So
That's good. That's how you plan. Ask any person that's in marketing that has a project that has to be done by a certain date. Believe me, they didn't just start planning for America 250 yesterday. That's been in the works for some time. So anyway, having said that, and here again, I hate that I can't just get a question from somebody or an answer from somebody, but we might be able to let you go a little early.
oh, we do have a few. I just checked the Q&A. We do have a few more in there, Senator, before we
Okay.
go.
Okay.
So it looks like we just got a suggestion of maybe a potential person or an agency to come on is the Department of Medicaid, bringing them on the call maybe to explain, because obviously a lot of these things are coming out of their agency. So that was Raven Oglesby suggesting maybe we have the Department of Medicaid be on the call. And then this is Ryan Sickles with the YWCA of Greater Cincinnati. And it says, some organizational challenges that we have seen include loss of funding, so like grants not being renewed, and the ending of some partnerships. In turn, we are having to consider staffing and programming and are now on the search for replacement funding sources so that we can keep staff and important resources for clients.
Let me say this, that's a biggie, and we're all gonna have to figure this out. It's kind of like the domino effect. We don't realize until we do things. Say with Planned Parenthood, we're gonna just take their money because we don't like what they do as far as abortion. Well, Planned Parenthood was Planning Parenthood, which was medical assistance for many women. And so that makes a huge difference. And with the YMCA, you folks are focusing on taking care of people, period. And I think that it's important for us to figure out, okay, Ohio, the feds are taking some of our money. We're going to have to figure out where your priorities are. So we're going to have to look at grant funding a little differently. As a matter of fact, we'll look at staffing a little differently, and you may have to adjust who you're asking those dollars from.
Right. And Senator, I will mention just for the group too, I know we briefly said, it's busy time. This was we appreciate everyone's making time on like kind of a shorter notice in terms of the shift of how we were doing the meeting today. And, someone mentioned, just a more advanced notice of a meeting. And I just want to comment that typically, this is a little bit of an exception, but typically we do send it out. We book people out each month for our meetings, and, we'll be able to send out that notice much more in advance and have everybody be able to have time to join on and be prepared. But we do appreciate the feedback about that because, obviously we want to make time and be considerate of others' time so that they're able to participate and not feel as if they missed an opportunity. But again, this is just a little bump today, but normally how we typically do send out a pretty at least 2 to 3 week in advance notice. And I will say too, for planning purposes, even if maybe like in the future, maybe I don't know exactly the date or the people, I will say I would keep your mind open to, the meetings are always gonna take place on either the third or fourth Thursday of the month. So at the very end of the month, and they're always gonna be at noon. So just for planning purposes, generally, those are the times that we block it out. It's always gonna be the third or fourth Thursday of the month and at noon for an hour. So we appreciate the feedback though, obviously, and we're happy that you were able to make it anyway today. We appreciate that.
Right, because usually we started out with it being the fourth Thursday, then we ran into some complications and had to change it. But you're
Right.
absolutely right. There's nothing worse than a week before getting some notice going, hey, did you forget that you're supposed to be on this call? Well,
Right.
no, I didn't forget because I didn't know. So let's see what happens with that. But I appreciate that. And Deja, we're gonna have to pin down which one it is, definitely, unless there's a holiday.
Right.
It's the fourth Thursday, and I'm thinking of that Thursday, we're thinking Thanksgiving. That's already,
Right.
so let's think about that for sure. So thanks, person who reminded us of how goofy it is not to know in advance.
Yeah. And then, Senator, I will say we got a message from Representative Lawson Rowe. She's on the call, and she just I figured I'd let you know as well. She's interested in helping with and supporting the second planning or the planning for the second annual summit. So I know she was a participant. We're grateful for her being there as a panelist that first go around. So I'm sure you're more than excited to have her hop back.
And Lawson Rowe, we also need co-chairs too. Who knows what's going to happen?
Right.
Hicks and I are up for re-election next year. Somebody has to keep this work rolling because this isn't about just us, and it's not really just about pregnant women or little babies being born. It's about families. And families are about what we need to be doing when we pass laws at the State House for our constituents. So Thank you. Thank you, Lawson Rowe. You're not going to get off the hook on that one.
If anyone else has anything they want to add to the Q&A, please feel free to do so. Maybe we can give it a minute, but then if not, then we will probably wrap it up. But I will go to the last slide just so folks have our contact information as well. So the first, Senator Ingram, our contact, our office phone number, as well as our district email. Same for Senator Hicks Hudson, her office phone number, as well as her district email. Always feel free to reach out. Somebody will answer the phone, or somebody will definitely get you responded to with the email response. So.
Sounds good to me. We're going to let you off 13 minutes early. Of course, though we started a little late. But anyway, I'm sure Senator Hicks Hudson will be with us the next go round, she and her staff. But I know that she had another engagement that she probably just had to go straight to instead of being able to jump on this call. But here again, I appreciate each and every one of you who are in attendance. And of course, my senior aide, Deja Kidd, has your information. We'll send the slides to you, and we will keep you updated on changes that are continually being made, because they're still making changes right now, especially when you have the conversation about Medicaid and who's impacted, the Department of Education, who's impacted, all those things from the federal level, which are trickling down to the state level, or things that are at the state level, which unfortunately are trickling down to the municipalities. Some of our counties don't have the dollars that they used to have to be able to supplement providers. And so that too is a very interesting kind of turmoil that I think we're going to be in the next year or so. So thank you, folks.
Thank you.
I'm